Hi everyone, and today's lecture is about dosage forms. Dosage forms are what we use to package up active ingredients or drugs that are going to work in the body. So the learning outcomes for this lecture, let me see, about 7 of them. The first one is that you can describe or define what a medicine is and understand its main components. Explain why active pharmaceutical ingredients are rarely used alone for administration to patients. They're always packaged with something else. Outline some of the main functions of excipients during pharmaceutical formulation and recognize some of the commonly used types of excipients. Define what dosage forms are and also describe some benefits of incorporating drugs into various dosage forms. Describe 2 ways that dosage forms can be categorized, recognize the different types of dosage forms available, including solid, semi-solid, and liquid dosage forms, and finally, compare and contrast the use, advantages, and disadvantages of the dosage forms from each of the above categories covered in this lecture. Now, again, there's a fair bit of jargon in those learning outcomes, but by the end of the lecture, you should know what each of those words mean. A really good hint would be if you want to start keeping a glossary. A glossary is a bit like a diary of new terms that you've learned so you know what they mean. And I try whenever possible to keep the language simple because you are only first years, but occasionally we have to use the pharmacy language and you're starting to learn a new language. So let's look at medicines. So what's the definition of a medicine? A medicine is a therapeutic molecule, which we also call an active ingredient. And I like to use the term it's packaged in a drug delivery system made of non-medicinal or inactive ingredients. The active ingredient provides the desired pharmacological effect in the body. That's how a drug works. It causes a pharmacological effect. And each of the inactive ingredients that is packaging that active molecule has a different role. So it might help the manufacturing process. It might get the therapeutic molecule to where it needs to be in the body. It might help with dosage accuracy, especially with small doses of therapeutic molecules. Some doses go down to nanograms, and that's a millionth of a gram. So that's very tiny. That's just a speck. And we can't get a person to take a speck of something very accurately. The inactive ingredients also help with medicine stability. That's been one of the big advantages of the medicinal pharmaceutical world, is that we've learnt how to make dosage forms that are stable. Many of these products have come originally from herbs, and herbs, because they're plants, they don't last longer. But when we manage to pull out the active ingredient out of the plant, for example, quinine comes out of the bark of a tree. Once we've managed to synthesize that molecule and we can put it into a tablet, it becomes much more stable. And quinine is used to treat and prevent malaria. And also, having dosage forms make medicines much more convenient to take. Active pharmaceutical ingredients, as I said, are rarely used alone. Some active ingredients can be really potent, so you only need small quantities. So if you have a medication that has a dose of 150 milligrams and one that has a dose of 2 milligrams, the 2 milligram product is the more potent. So it's almost impossible for consumers to safely obtain appropriate doses from bulk material. Some active ingredients, some medications have an unpleasant smell or taste. And if they taste yuck, people aren't going to take them. Some active ingredients are chemically unstable and they might react with light or moisture or air. So by packaging it in a product that protects the active ingredient from those factors, it can last much longer. Some active ingredients are broken down at the site of administration before they can be absorbed. So we all know that we have a very strong acid in our stomachs, and when we take certain types of medication that are based in a protein structure, the acid in our stomach just breaks that down. So by putting a protective coating around that active molecule, we can get it to the less acidic duodenum where it can actually have its effect. So pharmaceutical science is about putting all those concepts together to get the active ingredient, the molecule, into the patient so it works. So inactive ingredients or excipients generally have no pharmacological activity in the body. When they're formulated with active pharmaceutical ingredients, they function as three things. So there's carriers, they carry the active pharmaceutical ingredient. They're adjuvants in the manufacturing process. So when powders go through machinery, things get stuck, things need to flow, and these adjuvants help the manufacturing process. They stop, clumps of powder getting stuck in peel presses and stuff like that. Regulators, and they also regulate how the active ingredient is released in the body. So some medications are released in very slowly, so the drug can last for 24 hours. So an example is a drug called nifedipine, which is a long-acting tablet, and it actually is a shell of a tablet with a hole in the top, and the drug sort of spurts out of that hole over 24 hours as the drug goes through the body. So we can actually regulate how quickly or how slowly that active ingredient is released into the body. And if you want something to have a really quick effect, then we need to work out a way to get it into the bloodstream quicker. The idea is to get the molecule into the bloodstream and then it goes to where it needs to go. So when we select excipients, it depends on factors relating to the chemical stability of the active ingredient, the manufacturing process that's required, and how the body metabolizes or processes the active ingredient. Here's a list of the types of excipients you might see. Fillers or diluents fill out the size of the tablet or capsule, and they're a low weight active. So these are things like lactose and starch. Binders hold the ingredients in the tablets together. We don't want tablets falling apart on us. So binders stick all those granules together. Lubricants, this is one of the ones for manufacturing. That stops the tablets from sticking to the tablet machine punches. Glidants, that helps bulk powder to flow through the machinery. Coatings, so we have tablet coating, we have capsule coating, and we might even coat little granules, and I'll show you some of these during class, and those granules are released over varying amounts of time. Disintegrants, so once we've got the tablet stuck together, we need to know it's going to break down when we take it, and there's products like disintegrants, there's preservatives for safety, because especially with liquid products, they grow bugs really quickly, flavours to mask unpleasant tastes, sweeteners to make active tastes more palatable, and colours improve the appearance of the final formulation. In some cultures, the colour is a really important way of how they believe whether it's going to work or not. So there's been research for anthropology done to actually show that certain colours work better with certain groups than others. So the next thing I'm going to talk about is dosage forms. So what's a dosage form? A dosage form is the physical form of a pharmaceutical product, and that contains the active pharmaceutical ingredient or the active ingredient and inactive excipients, and that's given to the patient. The way I sort of think about it is that a dosage form is a gift. The active ingredient is the gift, and we package it round with all the inactive ingredients. So different types of dosage forms are used to deliver active pharmaceutical ingredients to different parts of the body. And the area of study called pharmaceutics, which you're going to start doing next year, that's about formulation, manufacturer, stability, and effectiveness testing of pharmaceutical dosage forms. As we said, if you can make a beautifully looking package, active ingredient, inactive ingredients, but if it won't let the drug out in the right place in the body, it's not going to work. So you'll start studying pharmaceutics next year. So some of the benefits of dosage forms. So having different dosage forms provides us with many advantages. There's accurate dosing and increased convenience. Part of our biggest challenge as pharmacists is for us to get people to take medicines when they need to take their medicines. It's an ongoing battle with some patients. It helps protect active ingredients from environmental factors or the acidic environment of the stomach. And both of those factors can totally destroy an active ingredient. And in some cases, it can make the active ingredient harmful. We want to mask the taste and odour of the active ingredient. I can't swallow tablets without chewing them. I'm not a good pharmacist, and one of my tablets is temporarily off the market. So I'm having to take capsules. And because I take capsules, I have to empty out the capsules. And the first time I put them in my mouth, like opened them up, put them in my mouth, it tasted really disgusting. So now I mix it up in applesauce. But the capsule can actually hide the taste. If you're not very clever like me and you can't swallow capsules, well, then you've got to empty them out and taste the insides, and they're not good. We've got targeted localized administration of the active ingredient, so things like creams, suppositories go into the rectum, we'll talk about that soon, and asthma inhaler. So when I take my asthma inhaler and looks for an asthma inhaler and can't find one close by, the medicine, the active ingredient that's incorporated into the aerosol goes down into my lungs, and that opens up my airways, and that stops my asthma attack. So dosage forms can be grouped according to their physical form or their route of administration. So if we're looking at physical forms, we're thinking about solids, so tablets, capsules, suppositories, semi-solids, so products like creams and ointments, liquids, suspensions, eye drops, nose drops, and gases, so inhalers. For asthma, anesthetics are gases. They're the main two. And then we've got our administration route, and these are important words to put in your glossary. So some drugs can actually be administered by more than one route. So we have oral by mouth, topical is by skin, inhaled is by the airways, ophthalmic is via the eyes. There's a lot of Latin in pharmacy, not as much as there was when I started, but these are all Latin words. Otic means by ears, rectal via rectum, vagina via vagina, and parenteral is via injection. Okay, so they're the administration routes. So let's start our exploration with solid dosage forms. So tablets are the most common. They're hard, they're compact, they're easy to administer or take, and they have a long shelf life. They can contain more than one active ingredient and excipients, things like lubricants, disintegrants, or sweeteners. And the coating is there. Not all tablets are coated, but when they are, they can mask the taste, they can make it smoother and easier to swallow, and they can extend shelf life because they protect the active ingredient from the atmosphere and stops them from deteriorating. There are some disadvantages to tablets, and these apply to every dosage form that's swallowed. There might be local irritation to the lining of the stomach and the gastrointestinal tract. And one of the ways we can minimize that is getting people to take their medication after a food when they've got something else on their stomach that just buffers it, for want of a better word. The whole dose might not be absorbed from the tablet because of first pass metabolism. And you'll learn more about this in pharmacology next year. But when you take the dose, the drug gets into the bloodstream and it goes to the liver and it's metabolized in the liver. And this is a mechanism to help make the drug active or put it in a form where it can be excreted. So you always lose a percentage of the dose. So if something has 100 milligrams and it has a bioavailability of 90, you're only going to get 90 milligrams of active drug to the problem. And that's generally not a problem when someone's taking tablets all the time. But if they are in hospital and you have to switch them from their tablet to an injection, you have to take that first pass effect into consideration. Some tablets are too slow for emergency situations. And you can't use tablets in patients who are unconscious. So these are all the advantages of oral dosage forms. We can also have sublingual, or that means under the tongue, or buccal. Buccal is your cheek, and that's dissolved rapidly in the mucous membranes and it goes straight into the bloodstream. So one of the drugs that we use under the tongue is anginine tablets or anginine spray, and that gets absorbed into that big blood vessel in your tongue and it stops the heart pain. The advantages are that it avoids the acidic environment of the stomach, it avoids those drug metabolizing enzymes in the liver, but there are some disadvantages. They can be irritant to the oral mucosa, and not all drugs can be used via this route. One of the other drugs that we use, like as a lozenge under the tongue, is nicotine. So when someone's got a craving for the cigarette and they quickly need a nicotine hit so they don't pick up a cigarette, they'll either use a spray or a tablet under the tongue. Chewable tablets are intended to be chewed prior to swallowing, and we'll have a look at these during our prac in looks at my prac thing next week, week 2, and they're good for people like me who have trouble swallowing tablets. There's generally vitamin tablets and antacids. They don't always taste that good, and they might encourage chewing of non-chewable tablets. Products like Mylanta, which is an antacid, that's used for indigestion. It's in a chewable tablet for convenience. So we chew it up to increase the surface area, and that helps neutralize the acid in the stomach that's causing the indigestion. We'll talk about that next week. Capsules are very common, but they are harder to manufacture than tablets. We have gelatin or vegan shells, and they contain dry, semi-solid or liquid ingredients. Now, when we see the word gelatin, as pharmacists, we have to remember that gelatin is an animal product, and it will either come from pork or beef, and that obviously causes problems for some of the cultural groups within our society. So if someone doesn't want to eat pork products or products made from a pig, we have to make sure that the product they've been prescribed has vegan shells. Okay, so as pharmacists, you can help people who have dietary observations as part of their religion to make sure that they can observe those restrictions. And there's two main types. There's hard shelled for dry ingredients. So a hard tablet capsule, you can just open it up and you've got powder. If you're like me, you just pour it in your mouth. I don't recommend that. It's just what I do. And then they're soft shelled. So they're quite squidgy. And these are for things like oils or active ingredients that are dissolved in non-aqueous liquids. So non-water liquids like oils or pastes. Capsules can mask the taste of unpleasant ingredients, And what you can make, and this was technology derived in Adelaide, you can actually coat granules with these fine coatings, and that will mean that the active ingredient is released over a long period of time. Effervescent tablets or fizzy tablets, they're dissolved in water or liquid prior to swallowing. They contain acidic substances and carbonates or bicarbonates. So when you drop it in the water, you get the fizz, and that's the carbon dioxide. They rapidly dissolve, and when you take it, they have a faster onset of action. Often they have colours and sweeteners, and that makes a nice, attractive and pleasant tasting fizzy drink. So I do indulge in a Barocca every so often. The tablets are generally quite large, they're sensitive to humidity, and it's a more complicated production and packing process. Another example of effervescent tablets is effervescent paracetamol, like effervescent Panadol. If someone has a migraine, the first thing they should be doing is taking 1.5 grams of paracetamol. And if you've got a migraine, one of the parts of a migraine is that your stomach and your guts just stay still, doesn't move. So what you need is to take a product in a dissolved format, that when you take it, it's dissolved, it's absorbed into the stomach really quickly, it gets into the bloodstream, it works. If your stomach stops moving and you take 2 normal tablets, they'll just sit there and do nothing. So that's a therapeutic use for an effervescent tablet, is getting it into the system more quickly. So lozenges are solid dosage forms, and they consist of the active ingredient, sugar, sweetener and gum. It's similar to a hard lolly, and it's dissolved in the mouth slowly. So you get slow release of the active ingredient. It sort of coats the throat, and that can stop people coughing or stop that irritation. So sometimes they do have active ingredients in them, like Difflam. This is my favourite thing, Difflam, for when I've been talking all day. Anti-inflammatory is benzidamine, and the antibacterial is cytopyridium. So that has an anti-inflammatory and an antibacterial action. The antibacterial action is a bit of a joke because most sore throats are actually caused by viruses, not bacteria, but never mind. And then you have the good old buttermenthols, like a sucky sweet. So let's look at powders next. Bulk powders are dry mixtures of active ingredients in a powdered state, plus or minus excipients. They're for internal use or external use, such as dusting powders like talcum. We often use these products in babies. Greater surface area provides a more rapid dispersion and absorption of the active ingredients. They're generally used for low potency drugs. That's why we dispense them in bulk form, and things like antacids, dietary supplements and mild laxatives are examples. There's also something called a divided powder. You don't see this much these days, but in some hospitals where children have unusual conditions or rare conditions, you may be asked to make them a divided powder, and there's quite an art in the folding of it. It's part of a pharmacist's art of compounding, and that a single dose is in a paper, and then they take the paper. So it's not something you'll see in general community practice, but you may see it in hospital practice. So semi-solid dosage forms are next. So the first one is creams, and they are semi-solid emulsions, and they can be applied to the skin or the mucous membranes. And they've got 2 parts. So the first part is an oily phase, for example, wax, and then you have an aqueous phase, which is water, and they generally repel each other. Okay, fat and water, they don't mix. Just get a glass of water, put a few drops of oil in it, and you'll see they don't mix. But if you use an emulsifying agent, the emulsifying agent actually combines the two phases together. And examples of emulsions are milk or mayonnaise, oil and water mixed together with an emulsifying agent. So in cooking, the emulsifying agent is usually something like egg yolk, and that helps bring the two phases together. So we combine the active ingredient with either an oily phase or an aqueous phase, so that's aqueous water phase, and that depends on the solubility. The advantages, and these advantages apply to most dosage forms that go on the skin, is that it exerts a lower effect. You have lower risk of systemic body-wide side effects, and they're soothing because when you put them on, water evaporates off and that causes cooling. So if you're sunburnt and you put some cream on your sunburn, the water in the cream will evaporate off your hot skin and that will make it soothing. So we have two types of cream. We have oil in water emulsions, which we call aqueous creams, and we have water in oil emulsions, which are oily creams. So aqueous creams are the most common semi-solid dosage form, and you will make a lot of them during your career here and throughout your pharmacy career outside. So they're small droplets of oil dispersed through an aqueous phase. They're nourishing and they're protective, and they're a base for the delivery of active ingredients to the skin. Now, one of the most common active ingredients we use in creams are corticosteroids. So corticosteroids are things like hydrocortisone, which are applied to the skin to reduce inflammation in conditions like eczema or dermatitis. They have good cosmetic appeal because they don't feel greasy on the skin and they can be easily washed off. Water in oil emulsions or oily creams are small drops of water dispersed through an oily phase. So they're more moisturizing and they're more protective than aqueous creams because that oily barrier prevents loss of water from two layers of skin. It can be used as a base to deliver active ingredients, but it's not that cosmetically acceptable. So if someone's got very severe dermatitis or psoriasis, they will prefer to use water in oil products because they're more moisturizing than the creams. And although they're not that acceptable cosmetically, they actually do the job better for these patients than creams. So some of the disadvantages of creams, and these do apply to most dosage forms applied to the skin, they can cause local irritation. Dose accuracy is limited, but generally not too potent. If we generally apply it using a finger, so you may get contamination of the remaining cream. That's probably more of a concern if people are using pots of cream because they stick their fingers in and contaminate everything. So it's always important before someone uses a cream is that they wash their hands really carefully or use hand sanitizer. They're less stable than solid dosage forms and you need special storage conditions. They can do something called crack, and when a cream cracks it means the different layers separate out and it looks a bit yucky. So let's go on to the next one. Now, ointments consist of an oily or greasy base with active ingredients incorporated into the base. They take some effort to rub into the skin, but they are good moisturizers. They stay on the skin and they prevent the evaporation of water from the deeper skin layers. They're used for serious skin conditions like psoriasis and dermatitis where the skin is very damaged. Part of our skin's role is to maintain homeostasis, and if someone's got a serious skin condition where the skin is breaking down, it's really important to keep as much moisture in as possible. They're not cosmetically acceptable. They're not used on the face just because they have a sticky and a greasy feel. Again, the main active ingredients we put in these products are things like corticosteroids for skin conditions. So gels are viscous, that's another word for thick, water-based dosage forms used for applying water-soluble ingredients to body surfaces. They can go over a large area very easily, and they can also go on hairy skin very easily because they don't clog up the hair. It's a water or aqueous-based phase containing the active ingredient, and that is dispersed through a 3D web matrix, and that's made of natural or synthetic gum. So gels are a big area of study in pharmaceutics. Our researchers here do a lot of work with gels and using gels to get products to parts of the body. So Talini, who's our program manager, you met her last week, she does research about using gels to get a protein called somatostatin to the back of the eye to prevent diabetes, damage to the retina through diabetes. They can also be used for anti-inflammatory pain relieving gels like Voltaren, which is an anti-inflammatory, or Bonjela, which is used for babies who are teething or if you've got an ulcer. Now, suppositories are small solid medication masses. You'll also get to make these in compounding, and they're inserted into the rectum. The shape and size allows for easy insertion and prolongs retention. These products melt at body temperature and the active ingredients are released, and they can exert either local or systemic effects. So we might use Ducalax. The way Ducalax works is that you insert it into the rectum and the lining of the rectum absorbs the Ducalax or the bisacodyl, and that causes spasms in the rectum, which causes bowel motion. With local, we can give drugs there that sometimes cause local effects in the stomach. So if someone has big needs for big doses of indomethacin, we can actually administer it with a suppository rather than a capsule, which would upset their stomach. So they are most often used to relieve constipation, pain, irritation, or inflammation associated with hemorrhoids. They're also used for people who can't swallow for various reasons, such as surgery or gastrointestinal surgery. Patients don't like them. Nurses like them even less, and some nurses would rather give a $40 IV bag of paracetamol in hospitals rather than a 2-cent suppository because they see it as better for the patient's dignity. So some cultures are very like suppositories. Apparently French people are very fond of suppositories. So again, medicines and what medicines people use are very much a cultural construct of what is acceptable. So I would say generally in our culture, suppositories would not be that acceptable. The advantages are that we've got mucous membranes in the rectum, so that helps us absorb these active ingredients really quickly. We don't have to worry about the pH of the stomach or the enzymes in the stomach and liver. Drugs, as I said, the drugs that irritate the stomach might not irritate the rectum. And it is useful for patients who can't swallow medicine or are vomiting. Some of the migraine products are actually suppositories because generally anything given orally during a bad migraine is not absorbed. Disadvantages: inconvenient to administer, low patient acceptability, you can get local irritation of the rectum, and the onset of action can be quite slow. So pessaries are solid medicated preparations similar to suppositories, but they're inserted into the vagina. In a few weeks' time, you'll actually get to see some of these. And they're inserted into the vagina and they melt or dissolve at body temperature. They're usually larger than rectal suppositories, and the size and the shape is much more varied. They might need an applicator to insert them, and you're going to learn how to do this. They're most commonly used for antifungal treatments, like for thrush, and for hormone replacement therapy. So liquid dosage forms is our next example. Liquid dosage forms can be used orally, such as a solution or a suspension. You can apply them to a skin like a lotion, to your eyes, to your nose, ear, or they can be injected. So the advantages are that they're good for people who have trouble swallowing, especially children and old people. There's generally faster absorption of the active ingredient. You can use them locally, such as eyes or nose or ears, and you can tailor doses according to body weight, and you can add sweeteners to improve taste. Disadvantages are that they have shorter shelf lives due to greater chance of bacterial contamination. You need to measure the dose out every time, and that causes decreased convenience. The patient must have a measure to which to dose it, and sometimes in the middle of the night when the child is cranky and mum or dad are half awake, sometimes mistakes get made with doses. You do need to measure the doses accurately, and they may require special storage conditions, so they might need to be in the fridge. So if we look at simple solutions, the active ingredient is completely dissolved in a liquid vehicle. It's clear, there are no visible particles. Examples of those are eardrops, eye drops, nasal sprays, and injections. So with that injection, we don't want any particles in that because that will block blood vessels if you give it. A linctus is a form of a simple solution. So it's thick and it has soothing properties, and we call that in pharmacy, we call that demulcent. So it can be soothing, like it soothes the throat so you don't cough, or it can have expectorant cough properties. So an expectorant is something that helps you cough up mucus when you've got an infection and you want to cough mucus up out of your lungs. It's not always good to stop a cough, especially a chesty cough. A cough is a way of getting muck out of your lungs. They commonly contain a lot of sugar, and that's why they're demulcent. So you have to be careful with people with diabetes. You give them in small doses, and they sip it slowly without the addition of water. And these are really only used for cough and cold symptoms. Suspensions contain insoluble substances that are suspended through a liquid vehicle. So it's quite similar to an emulsion in some ways. You've got your insoluble substance, you've got your aqueous phase, and they are mixed together with what we call a suspending agent. So the two halves have a suspending agent in the middle. So all suspensions have a cloudy appearance and they may separate on standing. So we have to shake them before administration to make sure that we're giving a correct dose. That's really important with a product called phenytoin, which is used for epilepsy. There's a big suspension, and part of the problem is that it sediments and the parents don't shake it up and the kid isn't getting the right dose of anti-epilepsy drugs. So shake it up, give it a good shake. I shake like a pharmacist like that, and it's redispersed. You can use it internally to be swallowed or externally in a lotion. An example of suspensions are the antibiotic suspensions you will have had as kids. So generally for kids it's suspensions like amoxil, all the Keflex, and analgesics like Nurofen or paracetamol. Lotions are liquid preparations intended for gentle application to the skin. They might be a suspension like a calamine lotion, which has calamine powder and bentonite in there. You'll actually make calamine lotion. It's a very big favourite of pharmaceutics lecturers. But in the old days, we used to use calamine lotion for itches. We have better things now. So if you were my age, when you had chickenpox, you got dabbed all over with this stuff. Or a lotion can be a thin cream, and that's usually oil in water. So it's used for treatment of skin diseases like eczema or dermatitis. They usually have antiseptic, antipruritic, so anti-itch or soothing properties. And that's the last slide. So we've gone through a lot of stuff in this lecture. When we do our workshop on dosage forms, we're actually going to handle some of these dosage forms and see how they behave. So that's a really fun one to do. We get a bit messy, but that doesn't matter. So I will see you next time.